Hello again and welcome back to Viewpoints on the Line. Well, according to a Globe and Mail columnist, Canadians are warming up to the idea of private health care delivery. Now, our question here is, are Canadians really warming up to that? Or is that just sort of a phrase or a sentence that's purported by the columnist in hopes that people start warming up to it? I mean, this is a debate. And according to this article here, he's basically saying that the professionals are warming up to it in a sense. I mean, I guess that's what he means. And he's saying that Canadians are following suit, but I'm not so sure. I mean, I'm hearing arguments still going pretty heavy on both sides. Quebec has been seen as a model of this, where when you look at the greatest concern among Canadians are wait times, and the possibility of starting to bill for service is being looked at as a possibility. But I want to start with you this time, Michael. Do you really think Canadians are warming up to that idea, or do you think there's still a little bit of doubt of exposing us to a two-tier system?
I'm a bit dubious about cherry-picking various polls. I haven't seen the underlying polls that Jeffrey Simpson has based his opinions on, so I'm a bit dubious about this. And of course, a lot of polling depends on how you phrase the question, who you ask.
Precisely.
You get the results. He's been on, he's a very smart guy, I have to say, Jeffrey Simpson, and he's been on this hobby horse for quite some time. What he's saying is that the cost of healthcare in Canada is increasing.
It certainly is.
It's increasing dramatically, and something has to be done about that, and he's absolutely right about that. No one right across the spectrum disagrees with that notion. But the fundamental question that has to be asked is, if we go to a system that relies more on private healthcare, is that going to bring the cost down, or is that just simply going to shuffle the costs off in some other way and end up with a system like we see in the United States, where you have some people who are covered because they're very poor, some people who are covered...
It's a for-profit healthcare system,
it
which
is.
I don't think Canadians really want to see.
And it's not any less expensive than our system, but there are a lot of people who are excluded because they don't have the public administration of one level of the system. So, you know, I think there are smart people like Roy Romano, who spent a lot of his time lately looking into the cracks and crevices, talking to the people that know about healthcare reform. He set out a pretty good prescription. I think the original vision of healthcare, if you go back to Tommy Douglas in Saskatchewan, is one that resonates with Canadians, and that is, people say that if you get sick, it shouldn't depend on your income as to getting access to the kind of care you need to get.
Universal healthcare, that's what we're based on.
I think everybody supports that.
That's true.
Well, I don't, but...
you don't support universal healthcare?
I don't support tax-funded healthcare, but that's because I don't think it works for anybody. And I don't think it's moral. But let me explain one other thing, and that is that we're hearing about Canadians and whether they are opening up to, or whether they're warming up to private delivery. Well, the fact is, private delivery is not an issue. A lot of the hospitals that people are using today, around for decades, are currently privately owned. The issue is that they're publicly funded. They're funded with taxpayer dollars. This is a false issue, this idea about paying more private hospitals. That's not really an issue. It won't change the fact that we're still in a universal funding system, and that's what makes it public. The fact that some private, a doctor's office is a private business, there's millions of, well, thousands of these, it's never been the case that there weren't public-private partnerships and, private delivery of healthcare. Most healthcare has always been privately delivered. The issue is, and it's reflected not so loudly in the results of this poll, they don't highlight it, that Canadians are warming up to the idea that instead of paying for paying taxes and using those taxes to pay for a government-run health insurance system, that they should be able to use their own money to buy private insurance. And the results also show in their studies that the greater number of those polled are in favor of allowing people to buy their own, have their choice about what health insurance they want. And when that happens, then health insurers, when they have to compete, will have to compete to earn the money that's paid by the patient. They'll have to please the patient, not the politician. And that's key if we're to have a system that's not only cheaper but better,
Yes. Now, one thing that Jeffrey Simpson highlights here, is that Canadians, by and large, want to see a better system, an effective system where the wait times are less. But something else when it comes to the Romano report that, unfortunately, he's saying here that most Canadians aren't even aware of what's really going on, of the moves that have been made of late by the government to try to deal with this mess of a taxed, an overtaxed medical system. We want to see it more effectively run, but Canadians generally don't want to pay more taxes. So to say that they're warming up to private health care delivery, I'm not even sure what that means anymore. I'm talking about the context that Jeffrey Simpson is talking about here, because it would follow that if most Canadians are not aware of what exactly is going on within the system, how could you make that leap and say that most are in favor of something? Unless perhaps they're just following reports that they see and they figure, well, that sounds pretty good, and according to that stat, maybe I should follow suit. I don't think people are by and large aware of what, according to his polling here, or what he says, they're not aware of what's going on.
That's true.
This is what he's saying. I'm not saying I agree with what he's saying, but
I think it is true. I don't think people, it's a very complex area. I don't think they realize that most delivery is already private. But I think that the reason we're seeing the debates we're seeing about delivery, everyone's focusing on delivery, but the people focusing on delivery are people who don't want the issue of funding to be brought into the public debate. And so we see even conservatives who are afraid that this would mean smaller government. They'd have to deal with union concerns. They'd have to deal with downsizing of the government, possibly some short-term unemployment as government workers had to find jobs in the private sector. They think it's political dynamite, so they will not bring up the topic, the real issue, which is who pays. Do you pay the doctor directly as a patient? Do you pay your insurer directly as a patient? Or do you hand over your money to the government and hope that they give you what they think you need?
Paul, what are you in favor of? Yes, go ahead.
Well, I was going to say, if you start to raise that question, then you immediately have to say, what about people who can't pay? And that was the problem before the 1960s when we didn't have this single-payer system that we have in Canada. That was the fundamental question. If you were poor, you got sick and you died. If you had some money, you got health care. And Canadians said, we don't like that kind of system. We want to have access. Now, it's a tremendously complex system now, but within this single-payer system, there are efficiencies in the system. We look at Alberta and look at how Alberta, for hip replacement, was able to streamline, save huge amounts of public dollars by bringing in some efficiencies into the system. There are all sorts of efficiencies.
That's a big way. We need to look at the efficiencies of the system. That's been shown over and over again. But Paul, you do agree with the universal health care system?
No, I don't. I think that it's wrong, that it disconnects the interests of the patient.
Okay, what happens to the poor? Now I know that we're running out of time. That's why I'm pressing you quickly on this.
Yeah. The poor have to pay for health care like they would pay for auto insurance. They would pay for health insurance the same way. And we did have, prior to 1968, actually, people did not want this system. Doctors threatened to go on strike. People didn't want to have to pay a brand new income tax. The Progressive Conservatives had to bring in the provincial income tax just to force everyone to buy public government-run health insurance. So this was not something they wanted to do. It's something that we've rewritten 2020 hindsight with, well, actually blind in one eye. It's not the case we wanted this. It's the case that we're stuck with it. And I think that we have to re-examine that and bring it back.
You're a poverty advocate here.
The defining feature, I think, if you ask most Canadians, what is the thing that makes us most proud as Canadians, is that we don't allow people who are sick to die because they can't afford to buy health care.
That's an issue of welfare. You don't have to transfer wealth by making all people buy publicly supplied insurance. You can provide money, if that's what's desirable, you can provide money in the form of cash so that the poor and the rich alike will still have the choices among which insurers they're going to buy. There's nothing in that, there's nothing inconsistent between helping the needs of the poor and having choice for the poor and the rich alike. They're two separate issues.
The system you're describing is the system in the United States, which is more costly. However you measure cost, they pay more money for health care.
And lots of suits as well. It becomes very market.
And lots of people who are in the gap between being so poor they get government help and so rich they can afford their own assistance.
It's expensive in the States because the United States governments require the plans to cover a host of things so that they can get votes and money from chiropractors and physiotherapists and etc. And if people just had the freedom to buy the insurance they want and need, there would be no problem for the poor.
Oh, Paul and Michael? Big difference here, and we're out of time.
There is.
Thank you both so much for joining me for Viewpoints.
Thank you.
Thank you.
We're going to go for a break now. When we come back, we'll be looking at tips for the winter blues. Stay tuned.